So I was just told that our host is delayed because you may know that we are in the middle of very important days in this House with hearings of commissioner designates and ancillary meetings around this process. So he will join us later on, but we will then start without him for the moment, and we will have also MEP Andras Skoulia, who is going to join as well. So we also have, as I mentioned, a few colleagues making their way into the building. As I said, it's extremely crowded these days, very important days in the life of your European democracy. And I see colleagues who were in the meeting with us earlier today, to whom I've been making the point that we keep democracy for granted, and we should certainly not undermine the process and the scrutiny that this House is operating towards another institution here in Brussels. So let the member of the House do their job and join us whenever they can. So without further ado, I'll immediately hand over to the President of EBC and for the introductory remarks. So Professor Suzanne Dickson.
Thanks so much, Fred. It's really great to be here, and good afternoon, everybody. It's a great pleasure to welcome you to today's event, which is called Bridging Neuroscience, Policy and Society here in the European Parliament. So on behalf of the European Brain Council, or EBC as we call ourselves, I'd like to extend our deepest gratitude to Mr. Tomáš Zdechovský, who will be joining us soon, for hosting us, and all of you for joining us for this policy-focused opening for our big event that's happening this week at the Egg called Brain Innovation Days. So the challenges we face in the field of brain research are simply enormous. Today, brain conditions, neurological and mental alike, are the leading cause of disability and the second leading cause of death. I'm going to repeat that: the leading cause of disability and the second leading cause of death. These conditions have a profound impact not only on those who live with them, but on their families, caregivers, and on society at large. The burden on healthcare systems, economies, and communities is immense, and it's clear that we must act now to change this trajectory. The fact is, understanding the brain is not just to address a burden. It's also to allow people to thrive, to live in health, and therefore also in happiness, to power our labour markets and economies, and to build future generations. Brain health has an increasingly critical role in our economies, predicated on the concept of brain capital, encompassing an individual's social, emotional and cognitive resources, with the world increasingly putting a premium on brain skills and brain health. So EBC has been working tirelessly to bring brain health at the forefront of the European policy agenda. They've been doing this through initiatives like the No Health Without Brain Health campaign. The wider brain community gathered to emphasise that brain health is not only integral to overall health, but to our societies. Additionally, we've called on the establishment of an intergroup on brain health and research with the European Parliament, a proposal that's currently under discussion among 4 political groups. This intergroup, if formed, would serve as a vital platform for driving coordinated action in brain health policy. Furthermore, we're actively advocating for an EU coordination plan for the brain, a comprehensive pan-European approach to brain health, research and innovation, and brain capital through the EU Health Policy Platform Thematic Network. We work hard, but all our efforts alone will not be enough. Achieving real, tangible outcomes for the millions of Europeans impacted by brain disorders requires collaboration on an unprecedented scale. We need policymakers, researchers, industry leaders and patient representatives to work together, each bringing their unique perspectives and expertise to this common table. Only by bridging the gaps between research, policy and society can we create solutions that are not only innovative, but are impactful and sustainable. So this is precisely the goal of Brain Innovation Days. Launched by the EBC, the event series is designed to foster dialogue, spark new ideas, and build partnerships that drive concrete change. Over the next 2 days, we launch our 4th edition under the overarching theme, Navigating the Brain Across a Lifetime. We will explore how innovation and policy can work hand in hand to address brain health across different stages of life. Today's discussions set the stage for what promises to be a rich journey of discovery, collaboration, and ultimately action. So today we're going to hear from key opinion leaders about brain health, exploring how policy can shape a healthier future for Europe. We will examine the societal economic impact of brain disorders, discuss barriers to research and to innovation, and identify opportunities for the start of a brain healthy transition. So tomorrow, Brain Innovation Days will continue with a series of interactive sessions where you'll have the chance to engage directly with innovators, researchers and patient representatives who are working at the cutting edge of brain health. So let's make the most of this opportunity to connect, to share and build partnerships that can bridge the gap between neuroscience, policy and society. Together we can pave the way for a future where brain health is truly prioritised and where every citizen has the opportunity to live a healthier, more fulfilling life. So on that note, I thank you again for being here, and I'm really looking forward today in the discussions that we'll have that follow. Thank you. Over to you, Fred.
Well, thank you very much, Suzanne. And I think we can even emphasize the fact that this week is an important one, as many of our like-minded organizations are organizing ancillary events to the Brain Innovation Days. We will be joined later on by EFNA and their delegation, who are launching their interest group within this House. We will also have the participation of representatives from national academies of science who are finishing their meetings as we speak. And later this week, we also know that national funding agencies will be gathering. So we can truly say that this week is almost a Brussels Brain Week. And our event this afternoon will be talking about bridging neuroscience, policy and society. I'm Fred Destrebec, the Executive Director of EBC, and I'll be your moderator to lead you through this program. And as we go, I'll be joined by different speakers, part of our program. But now is a test to your resilience because of the changes we needed to make and relatively last minute. Don't be surprised if they are not coming in the order that is mentioned on the sheet of paper that you have received. Anyhow, I'm pleased to give the floor to our first speaker, Professor Theo Vos. And Theo is coming from the Institute of Health Metrics and Evaluation and will give the first talk on the burden of brain disorders. So, Theo, the floor is yours.
Thank you very much for this opportunity to share some information from the global burden of disease with you. So I'm speaking on behalf of a big team of people who are working on the burden of disease in Seattle, but also with a now collaboration that exceeds 13,000 people across the world. Next slide, please. So, ours is the most comprehensive study of health in the world, and we've been a little slow in the pandemic years, but our aim is to provide annual updates of all the information. Importantly, GBD is a public good, and we want as many people to make use of the data that we produce, but in particular we aim at policymakers who have to make decisions on how best to spend resources on health. So, the global burden of disease allows us to summarize and compare health loss from 44 conditions that affect brain health in the EU and make comparisons to the rest of the world. And it's a simple accounting, the summary measure of DALYs, disability-adjusted life years, combine years of life lost, where we multiply all deaths by a remaining aspirational life expectancy at the age of death, and where we take prevalent cases of any disease and weight the prevalence for severity. In 1990, in the EU, these 44 brain health conditions accounted for 22.5% of the total burden of disease in DALYs, and that has gone up to 24.2% in 2021. Next slide. So, some things are dropping off this. So, there's, there we go. Some fancy stuff put on this slide. So, we have a set of primary neurological disorders like dementia, Parkinson's, epilepsy, migraine. Then we have infectious diseases that affect the brain, neurodevelopmental conditions, cancers of the nervous system, and a big category of mental disorders, including schizophrenia, depression, anxiety, and a bit of injuries, where injuries lead to traumatic brain injury, ranging from concussion to most severe type of brain injury. Next slide, please. Okay, so this is what we call it a tree map. It doesn't look like a tree map, but this accounts for the whole burden of disease. In blue are all the non-communicable diseases. In red are the infectious diseases and maternal and neonatal conditions, and in green, injuries. Now, the neurological disorders per se are sort of in the middle at the bottom, where you can read the mark for Alzheimer's. Then there's stroke, more towards the top there. There is brain cancer, and then the mental disorders more to the left in the middle. And then with a star, I've marked conditions where a bit of it is part of brain health. So there's a cognitive problem component of long COVID that we account for when we aggregate estimates for these brain health conditions. And similarly, for diabetes, we have included diabetic neuropathy as part of these aggregate estimates. And I already mentioned the traumatic brain injury and spinal cord injury that occur after injuries. Next slide. In our visualization tools, we do not yet have anything for this particular aggregation, but all these individual conditions or groups of conditions can be viewed. And so I've taken snapshots of the distribution of DALYs, age standardized for 2021 for stroke, for mental disorders and neurological disorders. And underneath these are very detailed information, data for age and sex and over time, as well as what I'm not showing here today, but forecasts that we make country by country of all the important elements of the burden of disease. Next slide. So when you look at it on the graph on the left in rate space, then you see a steady increase in the risk of being affected by any of these conditions. So at younger ages, it's more the neurodevelopmental conditions, including consequences of neonatal disorders or meningitis leading to cerebral palsy. Then there's a large contribution of mental disorders at young adult and middle adult ages, at least where it's most prominent. It's, of course, they occur across the whole age continuum. And at older ages, you see dementia, stroke, Parkinson's disease dominating. When you actually look at the numbers, then you can see that the numbers are much more substantial at younger adult ages. And also what you can see is the enormous dominance in terms of numbers of women affected by these conditions over the age of 75 relative to the many fewer men who survive to that age. Next slide. Here you can see it more expressed as a proportion of the total, where you can see the neurodevelopmental conditions dominating in early life, and then in this bright green, the mental disorders, with by far the largest component in older children and in young adults. And then the more classical neurological conditions starting to dominate at older adult ages. Next slide. Now, over time, since 1990, the component of the burden of these neurological or brain health conditions that is due to mortality has dropped quite significantly. And in the world, in red, more dramatically than in the EU, but also in the EU, quite a shift in the mortality component. And that means that the disability component relatively becomes by far the bigger share of the burden of these brain health conditions. Next slide. This one shows, it's a little busy and small letters, but the overall thing here is anything to the left is a decline, anything to the right is an increase. The overall picture is a 17% decline when you express it in age standardized rates for all these conditions. But some large increases for a number of conditions, including the common mental disorders like depression and anxiety. And you see that reflected in these figures going out to 2021 a little bit, but we're finalizing our estimates for GBD 2023. And one of the things that stands out is that there's been this rather large increase in the occurrence of anxiety and depression that initially we thought could be attributed to the pandemic years, but is much more likely a not so transient increase. The recent thought about that is that it may have a lot to do with exposure to social media, creating impossible examples, particularly for younger women, to follow. And there are a couple of country surveys that have shown a very alarming, almost doubling of the occurrence of these two already common disorders. And so something to watch out for, and something that we'll see play out when we get more data. We currently have it well documented for the Netherlands, for Australia, for the UK, but there are still lots of places where we suspect something similar is happening, but we don't know yet. And then all the way towards the bottom are the ones that are mostly dominated by mortality. So all the infectious causes, they have dropped quite dramatically over that 30-odd year period. Next slide. This compares the EU against other world regions, and you can see that the EU is pretty similar in its totality of these conditions to more generally the high-income world. But much higher estimates in many other parts of the world, and where you see the mortality component still contributing a lot more than you see now in high-income countries. Next slide. So, in summary, over 2/3 of neurological health loss in the EU occurs after the age of 50. But it doesn't mean that, therefore, the things that happen in younger people aren't important as well. The big ones that stand out overall: stroke, dementia, diabetic neuropathy, even though it's just a small component of the overall burden of diabetes, is in itself large and worryingly increasing, with the increasing obesity almost anywhere in the world. And I guess, we have to rely on the thriving Danish economy to help us do something about this. Over the 30 years since 1990, most of these brain health conditions, where they've improved, it has come from a reduction in deaths rather than an improvement in the disability. And that's a more general theme that, as health people, we've focused a lot on preventing death, but we're far less good at preventing ill health. And so a shift in focus, particularly also when you're talking about these brain health conditions, to think about what can we do to ameliorate these disabling outcomes is very important. I already mentioned my big worries about what's happening with depression and anxiety, and then the diabetic neuropathy increasing. This is just a small summary, snapshot. There's plenty available. Where things aren't straightforwardly available in all our online tools, contact us and we can provide you with bespoke aggregations, like we're doing for our colleagues in Europe. And the information is there, and we're keen to be helpful to this policy debate.
Well, thank you, Theo. Just I have a follow-up question on that, because you were saying that the data you're providing is to inform policymaking. Do you have a system of tracking decisions or coming up with recommendations and having a sense of efficiency in those recommendations? I know it's a banana skin, but it's probably to maybe discuss what you're anticipating at the HME as the kind of new development of your data aggregation and what is likely to come up in the near future.
Yeah, well, we would love to know. We spend quite a bit of energy trying to track where people have made use of the information that we generate. But often from unexpected corners, we all of a sudden hear from someone, oh, your data has been so useful and it has helped to shape policy in this and that way. Not easy to keep track of that, but we hear enough get enough positive feedback to think we're on the right track in providing all this information as a public good.
Mm-hmm. I'm happy to take one or two questions, but not more. So if anyone would like to raise a point with Theo's presentation, or was it crystal clear? And feel free to address any of those during the break if you're too shy to ask it now. All right. Okay, Theo, you've been absolutely good. Thanks again for joining us and for those elements to get ourselves started on our journey. And it allows me to invite our next speaker, for a slight discussion on neuroscience and society. So I'm pleased to bring on stage Dimitrios Georgiopoulos. So Dimitrios is Global Franchise Head for Neurology and Immunology at Merck. So, Dimitri, welcome. Thanks for joining us, and thanks for having agreed to join us. I've got a first question on my briefing, but I don't know if it's use, asking you why it is crucial to place brain health higher on the EU policy agenda after having heard what we just heard from Theo.
Yeah, I think, hi everyone, and thank you for the invitation, first of all. I think Professor Vos very brilliantly shared a lot of details on why we need to elevate brain health and neurological conditions in the agenda. As an industry representative, I want to throw some impactful numbers, though. 1 out of 3 patients, inhabitants of Europe, are suffering from neurological conditions. 1 out of 3. It's a big number. 3.4 billion people are suffering worldwide from brain health and neurological conditions. These are numbers that, if you consider them, are huge. And as Professor Vos said, the more we are getting good in reducing mortality, these numbers are rising in terms of morbidity and disability. And Suzanne mentioned at the beginning that we are talking about the #1 reason of ill health and disability worldwide. Nevertheless, we haven't done a lot if we consider these numbers. If we go on a resource utilization and cost perspective, it's estimated that managing brain health and brain-related disorders on a European level costs 800 billion euros per year. So these are numbers, of course, that have a tremendous impact, right? First of all, consider the impact on the individual and on the family. Then, if we elevate our thinking on the societal impact, on productivity impact, and overall on quality of life, if we consider the impact that these disorders have in the life of European citizens, it's a lot, and it's a call for action. Mm-hmm. Also, if I'm not mistaken, Ursula von der Leyen in their speech around guidelines in the European Commission, in the Action Plan 24-29, she mentioned very, very clearly that we need to step up our work in terms of managing prevention of mental health, brain health, but also stepping up our work in coming up with more treatments as far as it concerns degenerative illnesses that, of course, are a leading cause of disability. So if you ask me the why, I think the burning platform is very, very clear. And I think we can do a lot still about it. I think awareness has been raised over the years, and this is good. I think we need to acknowledge that. But when we compare, for example, the impact that we just mentioned and the effort behind it with the impact that perhaps cancer has and effort behind it, we see disproportionate effort. And I think cancer has given a very good direction in Beating Cancer Plan. It's a framework that we could very easily have as a foundation on what we can do further and follow it.
But you mentioned the speeches and declarations from Ursula von der Leyen, the Beating Cancer Plan as an example. Where do you see the role of the EU specifically in advancing, let's say, the cause for brain health?
I think if we see the landscape of several initiatives in Europe, we have a lot of several initiatives. But I think what we need to do is we need to coordinate efforts. We need this European coordination plan, EU coordination plan. We need a coalition. And I'm very much in favor, representing, of course, Merck, my company. We are very much in favor of the establishment of an intergroup. I think also the European Brain Council is very much towards that effort. And why do we believe we need an intergroup? Because there has been on a European Commission level the Partnership for Brain Health and neurological conditions, which is a very good thing to exist. And on the European Parliament level, there has been an interest group, but the interest group that brings together MEPs, patient groups, HCPs, researchers, it's an informal body. It comes together, of course, to elevate awareness, but it's an informal body. An intergroup, the way also European Brain Council supports it, it's a formal body that will make sure that we have a systematic cadence of all the relevant stakeholders coming together, elevating the right issues in the EU policy agenda, and advocating for not only increasing awareness, but also issuing policy recommendations. So I do believe a coordination of all the efforts and a systematic body like intergroup would be a very, good step forward.
So it's the parenthesis of self-promotion right now. So indeed, EBC has been instrumental in casting this request for an intergroup. We're just out of our General Assembly meeting where it was discussed. So any MEP that you come across when you leave this room or within this room, when you grab a drink and you join us at 6:30, please talk to them about the need for that intergroup, because the time is now and the deadline for decision is end of this month. So it cannot be more timely, and thank you for your support in that respect. You were alluding to the burden of disease for people living with a brain condition, the families, and by extension, the caregivers. We can do a little bit of teasing for tomorrow and the Brain Innovation Days that we will have in Dieg. Merck, you will be having a session on patient-reported outcomes measurements. Can you maybe give a little bit of perspective of why the inclusion of patient voice and caregiver's voice is, in your view, important in advancing brain health and brain research?
Yeah, of course. I'll be happy to be part of the panel tomorrow where we will discuss this in greater detail. If we see clinical research over the years, how it progressed, it has become very efficient, that we have very objective measures as it comes to clinical parameters when we want to introduce a new treatment or a new technology, a new diagnostic process. It has become very, very efficient that we have objective clinical assessments, lab tests, and of course anything that a healthcare professional is measuring in their practice. But it has also become increasingly evident that many times these treatments, if they lack the component of the patient-reported outcome, as we say, the patient experience, we see many times that in real practice they are even less efficient than they were in the randomized clinical trials, which means that there are components that still we are not measuring, and they are very much important for the patient well-being, the patient quality of life, and overall even the patient prognosis, right? I can give you an example in multiple sclerosis, which is an area that we are very much active. You can measure patient-reported outcomes at the beginning of the diagnosis of the disease, and patients that actually they have phenomenally similar components in terms of their clinical measures. They may have differences in how they report their own experience. The patients that have worse patient-reported outcomes at the beginning of their disease, they are more likely to progress in later advanced stages of the progressive part of the disease, even if at the beginning they seem quite similar in how their disease is progressing, which means that we are still losing an element if we are not incorporating the patient reported outcomes or the patient preference studies in our overall evaluation. Now, it's a good momentum, and it has also increased over the years the awareness of the importance. And it's a good momentum now because we have a shift in the overall environment of HTA, health technology assessments in Europe, with the new regulation. And the new regulation takes into consideration quite substantially the patient experience. It has a form of guideline, first of all, a PRO guideline that was issued. We are expecting a reflection paper from EMA that comes together with the new HTA regulation. And also, it has a provision of an HTA stakeholder network, and in this network, the patient groups or the individual patients can raise their voice in terms of their patient experience, and of course this overall will be taken into consideration in what we call joint clinical assessment, which is the first step of assessing a new technology when it comes to introducing new technology to market.
But very often when we have this discussion with patient organizations, they would call for what they would say themselves, a meaningful patient involvement. With this new regulation, would you call that the way to achieve a meaningful involvement of the patient voice?
The intention is there. I believe, for meaningful involvement. There is still some fine-tuning that needs to be done in terms of making sure, ensuring that we have the right patient voice, we have the right involvement, as you say. So I can give an example. The regulation is supporting more exclusion rather than transparency for reasons of conflict of interest, for example. So we know that patients need to declare conflict of interest when they are participating in several fora and platforms that they give their opinion. And of course, some of these platforms are also collaboration with industry. And of course, it needs to happen because that's the best way to develop a new treatment. You need to take into consideration the patient perspective. But imagine, in neurology, we have a lot of rare diseases, right? We have a lot of neglected diseases, and there, the patients that can really contribute are very few. So if you start excluding these patients because they have contributed in one platform, if you start excluding them in contributing in another platform, then you start losing some component of that meaningful input and involvement, as you say. So we are in favor of more of transparency rather than exclusion in this setup.
And as you were saying, so now we are reaching that stage and that shift of greater recognition of the patient voice and the caregiver's voice by the EMA. But they are very often coming back by saying, yes, okay, fine, but this data or this feedback is not methodologically robust or was not collected, let's say, in a meaningful manner or in a way by which we can take it as a robust input. So do you recognize this as a challenge, and would there be a way by which we can address that?
Yeah, it is a challenge, actually, and it has been a challenge over the years, right? So it starts from the fact that we have we don't have a harmonization of healthcare system overall around how we deliver services and care into patients across EU member states, right? It starts from this. It starts from the fact that we don't have enough education, both on clinicians level and caregivers or nurses, on how to collect in the best possible way high quality data. We also don't have enough guidelines on this, how to collect meaningful data, and also we lack even framework and platforms on how to report them. So I will give an example. When we file for a new technology in regulatory authorities, in some templates we even lack the place that patient experience data can be included. So it's also technical sometimes, the issue of not having enough provision of how to report this data. So it starts from education, awareness, capacity and time, fragmentation of services, and in the end, even a lack of a standardized way of reporting the data. Then, of course, I think it's fair to say that regulatory bodies that make the value assessments may play the most impactful role in actually providing the framework for meaningful capturing of data, right? Why? Because they will be able to say and distinguish, why do we need this data? Some of the patient-reported data can be needed for improving care. Some of them can be needed for value assessment of the treatment. So it's important to say every time, why do we need to collect this set of data? How do we collect it? And how do we use it?
And now I would probably come to the end of our conversation, but with the magic wand question. So what would you change, or what would you put in place in order to make sure we address the challenges on one end, but we also make the most of this new environment?
I think let's start from the challenges, right? We need sponsorship in leadership on the political level. We need a strong political leadership in order to advocate for the need of neurological conditions and brain health and ensuring that we are reducing the impact. We need, as I said, a coordination of different initiatives, a coalition of different initiatives, because the challenge is that there are a lot, but they are fragmented. And then with fragmentation, we don't have the impact that we want to have. We need awareness. It's fair to say that education on brain health is lacking, and also social awareness on brain health is lacking. Neurological conditions, brain health often are treated as a stigma, and that of course contributes to less diagnosis and less seeking of help from the patients and their families. So lack of awareness and education is key. And of course, everything in terms comes in the final step about the money, right? There's not enough funding and resourcing for brain research and for improvement of healthcare services and care on these conditions. So these are challenges that we need to tackle. How do we tackle them? I believe the first thing is to talk about them, partner, coordinate, have, as I said, an EU coordination plan and a coalition, elevate from our side, with our talks, the importance of brain health, and in the end, with these partnerships and with this coordination, we can make sure that we put high in the political agenda of EU the matter, and not only be efficient in policy recommendations, but also be efficient in policy implementation and enough funding and resources on achieving that.
Mm-hmm. Well, to me, it looks like a brilliant conclusion. I don't know how you guys feel in the room. Would there be any comments or question to Dimitri? Yes, can you please introduce yourself? And use the mic, please.
Okay. Hello, everyone. I'm Abdurrahman, and I'm studying neuroscience at the University of Texas at Dallas, and I'm interested in neuroscience education. So my question would be, do you think there are specific methods in awareness that work better than other awareness methods? And could we have examples of this kind of examples of awareness methods?
Yeah, no, thank you for your question. First of all, I must admit that one of the challenges that we face in neurology is that we have less and less people interested actually going into neurosciences, and we see across the world that it's not attracting a lot of young scientists as much as in the past. So, and this over the years will have a detrimental impact because we will not have enough people specialized in these disorders, and it's brilliant that we can discuss among people like you. Awareness can come either from cross-fertilization of knowledge and experience, so having platforms and fora that actually people can come together and talk is important. But this can have a strong impact in a local level, on a country level, for example. What we have seen as having a bigger impact is big awareness campaigns that can actually be translated in different languages in the countries, can be applied in different cultures. Sometimes we make a mistake of issuing a campaign in the US, but then we go to the Arab world or in China, and this campaign makes zero sense. So campaigns that can be applicable and be translated and be also felt and understood in all the different corners of the world, these campaigns have the bigger impact. And these campaigns should be backed from a roadmap, a framework. So it shouldn't be a one-off. It should be part of a bigger roadmap. And in order to have a bigger roadmap, you have to have this political will behind. You have to have will from European level or from US level, and also this support should be somehow mandated to be followed from the member states in the different countries.
Thank you very much, Dimitri. It was a pleasure to have you on stage, and looking forward to continuing the conversation in our chit-chat and in our further interactions.
Thank you very much.
So we'll now move to a panel discussion on uniting forces to shape brain-healthy societies, and it's my pleasure to invite on stage Mrs. Shiva Dostar, who is Director at the European Investment Bank, as well as Dr. Philippe Schwab, who is Senior Director for Government Affairs at AbbVie. So, Shiva, Philippe, you're more than welcome to join me. Thanks for making it. Very much looking forward to your contribution and your stake. Actually, Philippe, I wanted to start with you because we have had that discussion now with the burden and contribution from some of the challenges with Dimitri. What is your take on saying that brain health is relatively underrepresented or underserved in the policy agenda?
That's a good question to start with. I think if you look across the theme of this conference, which is brain health across the lifespan, I think you begin to understand where the policy gaps are, and I think the data that were presented really illustrates that. I think about it in my own family. My own relationships. My father suffered a traumatic brain injury. Both my grandmothers had a form of dementia, either vascular dementia or Alzheimer's. I've had friends that have passed away from ALS, and I have coworkers and friends who suffer from migraine. So, really, if I think about how much personally I've been touched, and my family have been touched by brain disorders, and I'm sure everybody in this room has had some kind of relative or friend or loved one touched. It's really compelling, and I think about how many countries I've worked in the U.S., Canada, UK, and now at the European level, where politicians have strived to have a greater focus on neurological conditions, on mental health in particular, strategies for mental health, and we're discussing that again in this new European Parliament. I think about it in terms of Alzheimer's strategies. We have citizens, we have individuals begging for these types of strategies. Mm-hmm. And really, if you think about it in terms of the burden that these illnesses put on our economies, especially our healthcare economies, we really need to advocate for and realize greater research in this area, greater emphasis on early diagnosis and treatment, to address that morbidity challenge that has been raised. So how do we reduce the burden as these diseases progress, and really work to find better, more effective treatments, so that we can reduce that personal and economic burden over the time. But I mean, we're begging for it.
Yeah, it's like asking a parent who is like his favorite kid. But where would you place the priority at this stage? Because you came up with a number of disease areas, but where would you put the focus? And again, as an industry contributor, how would you see that situation?
I mean, I think there's a lot that we know, and I think there's even more that we don't know about the brain. So I think you really need to address each aspect of the development cycle. We need a great deal more basic understanding about how our brain and our nervous system works. I often think about it in terms of Alzheimer's. How can you treat Alzheimer's if you don't really understand how memory is stored? How can you correct memory loss if you don't know what it was before it was there? So we need more basic research. We also need more experimentation in developing effective therapies. I mean, neurological conditions is a graveyard of the pharmaceutical industry. Think about how many treatments associated with Alzheimer's have failed. Think about how many treatments associated with ALS have failed. It's very difficult to find substantial improvements in mental health conditions. And I think about AbbVie's pipeline, which has all of those in it, and the risk associated with developing new therapies in that area. And then the ability to actually deliver those therapies to patients, because they're often complicated, they're often full of risks themselves. So we need basic research, we need industry to continue to take the risks to do that, and we also need health systems to basically try the treatments that come. Okay. And so we need it across the spectrum.
So what's great is that I wanted to bring Shiva in, but you depicted such a nice picture of like graveyard risk failure. Shiva, I'm tempted to ask you, what is the EIB now coming to do in that complex territory?
Well, I mean, first of all, thank you for inviting me to this session. I feel like I'm a bit sort of the odd one out. I don't know are there any other investors or bankers in the room? No,
They'll be there tomorrow.
They'll be there tomorrow. Well, but I hope that we all agree, and I think Dimitri mentioned, we do need money, right? Do we agree on that? Because that, I think, is the entry point. And
now we know how you were invited.
Yes. So for those of you who just made by brief introduction, so the EIB is the Bank of the European Union, the European Investment Bank. It is indeed the largest multilateral development bank, maybe twice the size, to my American friends, twice the size of the World Bank. It is indeed a very important system player. It is also in the EU the climate bank. And indeed, if I look at a lot of the brain discussions, and one reason the more I learn about it, the more I believe we really do need to see the connection between brain health and our planetary health and climate change, because clearly these things are not disconnected. They are very much related, and there is a chronic underinvestment. Coming into this space, I think, is very important. And I was reading the title of Bridging Neuroscience Policy and Society, and I was like thinking, yes, and first of all, who is building the bridge and who is financing the bridge? So I think this is, again, but also then the bridge to the investor community. And I think, given the urgency of the matter, it is really important, I think, that we are developing a narrative. I mean, we were discussing earlier the importance of data, of raising awareness. I think and this is how the Institute, in my role as the head of the EIB Institute, where I see the value added, we need to now be the bridge to your community, to the scientific community, to the business community that is actively engaged and understand the investment needs, but then translate it into a language where the financial community understands it. Mm-hmm. It is fascinating when I speak to other investors, and in fact, I had lunch with two of my two colleagues from the European Commission on the innovation side, and I was telling them I'm coming to this Brain Innovation Days, and they said, oh, brain innovation, that's so interesting, brain and brain economy. And I was like thinking, it is interesting how little traction or when I generally speak to people that I'm very excited about brain economy, as I'm getting more informed about it, how little, people, we all agree how important it is, but we actually have not realized how underinvested the space is. And I think this is, to me, this very interesting dichotomy. People tell me, oh, are you saying our governments are not putting enough money into basic research? Are you saying that the pharma companies that are so flooded with cash are not putting enough money into this? I didn't know that there was a problem of financing. So I do think we have to get our narrative right, and that's the one point that, and sort of when I look at it then in how to do so, I mean, there are two angles here. There is, of course, the narrative that we use what it means as a public sector investor. This is a narrative that hopefully together with people in this building, with the European Commission, with other public sector banks and institutions, we get what is the role of the public sector in mobilizing investment. And with that, how do we then mobilize more private capital? And this is where I think our data, again, when we look at finance gaps, there is a study that the EIB a number of years ago published on financing medical breakthroughs. And I believe that the findings are as relevant for this conversation as for many other disease areas. The study basically highlighted that money, first of all, that there's a herd mentality among the investor community, that money goes into the low-hanging fruits, and investors sort of follow those other investors, that there is generally a lack of patient capital, that venture capital may not be sufficiently patient in a lot of these disease areas where you need these longer-term investments, that there is that the whole financial system is, and if you just look at the pension funds, that there's an allocation problem. We have, if you think of your pension funds and your insurance companies, I mean, especially insurance companies, they are sitting on billions, if not trillions collectively, of capital that they need to invest in, as part of making sure that they are well capitalized. And they are paying out, and we heard about the disease burden, they're paying out, a lot because of the disease burden. And the question is, how come that we don't have a system where that money would actually go where it is most needed, into research and development, within financial mechanisms that perhaps provide, the right risk-return metrics. And this is where indeed the public-private capital needs to play together. And I would add also philanthropic capital to this. So, as you can imagine, this is a topic that certainly is absolutely very relevant for the European Investment Bank, but clearly this is something that we need to all work together to as a narrative to develop so that we can go and get others engaged.
But can I take you on this? I mean, are we in the right track? Because making the case for the value of these investments, and obviously the seed investments we could benefit from public investors, are we on the right track with an event like this? Addressing the burden and then anticipating some of the challenges and then addressing, let's say, options, and tomorrow and on Thursday, just like promote and showcase the advances and the successes from basic research and how it is now benefiting patients, and having examples of multiple concrete innovations becoming a reality to improve outcomes for people with a brain condition.
I would say it is certainly the beginning of the story, but it lacks to. And I think this is the challenge that we have as let's say, an investor. We need much better granular understanding. What I'm lacking still to this day, because I'm also trying to, for our own needs, to understand how much is needed in infrastructure, investments. We're talking either hospitals, research centers, and so on. How much is needed in R&D that is on the more commercial side, and how much is needed? So public sector R&D, private sector R&D, where are the gaps? I have to say the narrative is still very high level, and it hasn't yet landed to a point where we can then say, these are the gaps, these are the needs, and hence, and then have a sense of the risk profile. That is. And hopefully tomorrow you will have people who will discuss that. Yeah, definitely. But I saw Philippe also raising his hand and wishing to respond to this. So
I think it's a really excellent discussion, and your comment about the patience of capital I think is an important one. When I think about what I said about the development risks, the failures that come, and the money that the private money, the investors' money that is spent on those products that fail, but that do generate information for the next ones. It's an important consideration, and it's where is the return on investment, especially when you see new medicines, new treatments that are developed, but then it's a real hurdle to have them used. If I think about the space that we work in migraine, it's a real patchwork of access for patients across Europe. Some countries are very hesitant to treat migraine or use the new medicines. If I think about Parkinson's, again, there's a great deal of innovation that can help manage the system, manage the morbidity, the disease. It doesn't cure it. Well, and then the systems say, well, it doesn't cure it, so we're not going to use it. I think about the Alzheimer's treatments that have been already approved, but very rarely used. So we need to be able to encourage and reward those investments that do take place, that do get products to market, by showing that there is a way for patients to benefit from those products. That is also a reward to capital and an encouragement for further investment and experimentation.
Well, what's great is that letting the two of you interact on stage, you're making a perfect case about the event that we've generated and that actually will start tomorrow, because this is exactly what we wanted to promote, as Suzanne was saying in her introductory note. Shiva, I guess you will have 2 days where you will be bewildered by all these demonstrations. Is there a hope to convince you?
No, I definitely want to not come in as a skeptic. I'm very much, I'm convinced that this is absolutely necessary for institutions like the EIB to, and we already are investing in health, and we have also investments in biotech companies that are involved in brain disease. But I think the scale of the investment that is needed, given the disease burden that Professor Toss and Dimitri and others have mentioned, is just at such a level that we clearly I think we're in a case where we don't know what we don't know. I think that's where we are as an investor community. And I think for you neuroscientists, sometimes we sort of refer to we need more finance in science and more science in finance. And that is very often why we have major innovations not happening, because there's a high perception of risk when investors don't understand the science behind it. I think brain, to me, is one of the most complex disease areas. I think there's an immediate sort of, especially given what you're saying, an immediate sense of, well, you know, if even the pharma companies who know the science so well are losing money, why would any financial investor ever get in? Mm-hmm. But given the societal challenge and the disease burden, and therefore also the benefit, we do absolutely have to tackle it. So I think, as you mentioned earlier, there has to be much more policy conversation. I don't hear enough brain economy in the everyday language of EU policymakers. I think it would help any campaigns that can happen at the sort of national level. But then coming back to the investor community, really helping us or scientists trying to understand how, or telling us very clearly where the needs are and how investors can come in and actually make money, because I think there's a huge demand for the products that ultimately come out of the research.
Yeah, definitely. And obviously it's a fantastic transition. As I'm just informed, our MEP host is on his way. So coming to the policy ask, or the policy change that you'd like to see. Philip, is there any you can think of?
The one that we talk about a lot is where does the burden of neurological disease end up? It ends up in our social care systems. It ends up in our care homes. It ends up in our healthcare workforce burden. It ends up in other places in the healthcare system. where does the accounting for treatment come from? It comes from in the drug budget. So the drug budget says we can't afford these treatments. We don't trust these treatments will work. We're going to delay treatment. That adds cost to the workforce, to the social care budget.
We could even say by extension that our willingness not to invest or reluctance to invest into basic research, because that's what we experience too, is exactly the same. Yeah.
So, I mean, I can't believe I'm saying this, because if we can break those silos, and we've been talking about this for years, but if we can understand that investment here results in not in savings, but a bending of the curve in the social care, in the workforce burden aspects, that is the policy understanding that I would like to see. We've been debating for the past 3 years the EU pharmaceutical legislation, which is proposing to reduce the incentives for innovation in drug and pharmaceutical development. Meanwhile, we need more innovation to prevent the crushing burden on our healthcare workforce and our social care network. So the understanding that those things are linked would be the policy change that I would make.
Yeah, thanks. Shiva, you were saying more discourse or activities or promotion of the brain economy. Would like to push it forward?
Yes, exactly. I think we really need to try. I guess you are into translational research, so I think we need to translate a lot of the, your language into bring in basically translate into the language that investors, both public sector investors and private sector investors, understand. When I say public sector investors, I refer to institutions that are owned by the governments and have therefore in their remit to actually address the risk-return asymmetry that I think, Philip, you're referring to, because as a company, as an entrepreneur, you're taking much more risk than the return will ever come back, because the return is also societal. And therefore, there is an absolute case for public investment money to go into this, to basically create a level playing field get the risk return in balance. Hence, but how do you? I mean, so what I hope we get a better understanding of is indeed really where the needs are, because that's where we are probably all trying to. And where would you like to see the money going in as a most urgent business case? I mean, that to me would be the burning question, because then we can hopefully, together with the European Commission, look at the risk-sharing metrics that we have done a lot of good work on the climate front that we can translate into this area and in other areas as well. But we need to maybe better understand where the needs are.
Okay. Well, thank you for that, and thanks for this vibrant message. I see that our host, MEP Tomáš Zdechovský, just arrived. So, Tomáš, I'd like to invite you on stage. Of course, it's primarily your event, and we're privileged to have you with us this afternoon. So, thank you, Shiva. Thank you, Philip. So, Tomáš, we've been discussing quite a lot. I know, and we know you're very busy because these are special days for the Parliament. No need to go back on that, but we really are privileged to have you hosting this meeting and present with us. Obviously, discussions about the burden of disease, of brain disorders that occupied us, but also quite a lot of the challenges about the need for research, the need to be able to translate that research for improved outcomes for people living with these diseases. But we also had contribution from the European Investment Bank representative for the need for investments. So this is, let's say, some and a glimpse of only a few of the points that we just discussed. But we are happy to have your perspective and your contribution to this meeting. So the floor is yours.
Thank you very much. I'm very happy that I can start this meeting. Sorry that I was not at the beginning because we have it still hearing about how to spend better the money and in more effective way. And I think that spending our money to train our brain or to have it any research about our health condition is very useful and it's very important. I have to start with one personal issue because I conclude my PhD study in rehabilitation. Also now I am a new doctor, and I hope so that I will really share more my experience, especially with brain research in university environment, because there is a lot of things what we can share, and me as politicians who had it really this personal engagement in this topic, it's very important because it can really have a huge impact to our society. Second thing is what I would like to say, that we discussed this issue for 10 years, and I see there a lot of progress. When we started, we were here in European Parliament in tents. Also there was 10 people, not so many people what were prepared to discuss any issues. We were only complaints that we don't have it money, and now step by step we see that money for brain research are increasing. And thanks to you and thanks to your participation, that you are here coming, and we can openly really share that more and more people is interesting about this issue, and this issue is quite important. Third things, what I would like to say, that there is really a movement of MEPs, especially young MEPs. I'm still young, 45, but
that's very young.
But I have to say that young and more progressive than me are very interesting about the issue of mental health, of brain research, and I see that for the young generation, especially for generation of my children, because my oldest child is 20 years old, is something what is normal. Also some things what's really it's not a topic what is taboo or tabuized, but it's something what show us high. To have it something what will be normal for the new generation. The pandemic 19 show us that really we need any action. And the discussion was enough, and now is the time to do something, and something more. I hope so that we don't need so much public money. It's really very sexy and very hot topic, especially brain research. Also, I think that we will find it a lot of investors and people who will give us the money for investment in this crucial area. And I hope so that I will find more MEPs who will come and share this experience with you and with your perspective in their own country. Especially in member states, we have to do a lot of homework, because in European Union and European Parliament, European level, we understand this topic a lot, and we understand why we need it. But in member states, they are still fighting against us, and they are still saying, "Oh, we have it a lot of problems, but solution is not coming." Also, we need to do this homework, especially in the media. It's enough of words from my side. I would like second time and last time, thank you a lot. You are why we are doing these events. You are for me, most important people, because you are face of this campaign, what we are doing. And I would like to thank all of you and all organizers for great work and for the supports, because I think that really the next generation what is coming will have this topic as the top priority, and I'm very happy for that. Thank you very much.
Thank you very much, Tomáš. And we are privileged to have Andras Kulia having joined us as well. Obviously, the first mission that I gave everyone, so I'll lead by example. I gave the mission to everyone to promote our call for an intergroup and coordination plan. So now that you're on stage, we need to tell you, vote for the intergroup and please help us get the coordination plan. So this is how we do lobbying in Brussels. No, more seriously. So Andras, we were just updating Tomáš on a few of the questions that we have been discussing so far, and actually I know that there is one you absolutely wanted to talk to us about, and Tomáš alluded to it. It's the rising epidemic of depression and anxiety, but also the use of social media. This was evidenced to us by Professor Theo Vos from the Institute for Health Metrics and Evaluation. Given the evidence and the research, but also the concern and the rising concern in society, where do you see that we need to address it, or where should we start in getting a real concrete policy action to address this challenge?
Thank you very much, and thank you for having me here, and it's a great honor to be here. I started my career as a psychiatry resident, and I think these topics are much more important than people usually think. How important they are. We see how these new technologies can help us, but also we can see the other side of the coin, that there are some effects on our population, on our society, that heavily affect people's lives. And you mentioned the depression. We see that nowadays you can text to anyone, you can make friendship through the globe, and having discussion from people from Australia, from US, or different parts of the world, but especially the younger generation is more and more lonely, and they have many of them have no real connections, I don't want to say real friendship, because this friendship through the social media, through the different forums can be real, but it's very different to sit with somebody in the same room and have a discussion and eye contact and feel the non-verbal communication, because we don't really see this but feel this, and it has a huge effect on our mood. And many people see these beautiful lives on social media, that everything is perfect. And I know this is not a new thing. We all see this, and we all know that it's a huge problem. But in the time when somebody has a big stress factor in his or her life, and opens the social media just to relax and sees these pictures, these beautiful videos about different lives, it can push it in a much deeper state and depression, and I know the biological background of the depression, and that I'm sad for one day is not the depression. I want to clarify this, that I'm not talking about this, but the global effect of this platform. But also we can use these platforms for a good thing, for the education, and that was my purpose when I created my social media platform, my TikTok channel 3 years ago, because I witnessed the big need from patients. At that time I was working as a surgeon for more information, for reliable information, more information about their conditions, and sometimes when I had 4 or 5 surgeries at night, I couldn't make these personalized discussions, so I decided to find another form to get the core information, and afterwards I can discuss the situation with patient in a more personalized way. And when I started, I thought that I will have 100, 200, maybe 1,000 followers, but actually after exactly 6 months I had 100,000, and I have now 370,000 followers with more than 100 million views, and these are only Hungarian views because my channel is on Hungarian language. And I think I see that there is a big need for this type of information, and my social media channel not popular because of it's super new and I invented something new. No, there's the sign of the need in people from the reliable information, and we can use this wisely. And to me, it's very important to inform the patient, to inform the people, because if we health professionals we don't do this, other people will, and will spread misinformation. Not because they want to harm, but because they have not enough knowledge on that topic, and I think that's our crucial role as health professional. And in my new role as an MEP, I have the responsibility to get as much information as I can get, to see different perspectives and find those key points and elements where I can do something. Even a little thing, I think, is a success, because we all know that here in Brussels everything is a little bit slower, but not because we want to make it slower, but because we want to make the best decisions. Sorry for the very long answer. Just wanted to share my perspective on this topic.
No, not at all. And actually, you've started addressing one of the points I wanted to come to, because we talk obviously of the relatively negative impact of digital platforms. We were also mentioning that to young girls in particular, it was more detrimental than to young boys. But we also have a positive side of the coin with, you mentioned, digital platforms where you can engage with a wider audience. In one of the sessions where our Vice President was speaking, you were raising the point of telemedicine and artificial intelligence and how it could help or provide benefits. Maybe you'd like to comment a little bit more on that side?
Absolutely. I think it's another key part of the new digital inventions where we can use them for helping people, because with these new technologies we can develop tools what can analyze the voice, help to general practitioners to detect depression before the very visible signs of depression or other neurological problems like Alzheimer's disease or frontotemporal dementia, Lewy body dementia, or Parkinson's disease. During the med school, I was involved in research where we tried to find those signals in human voice with which we can recognize depression, and actually it was a very successful research, and there was only a 1 minute long text that patients read, and we could use the data, and the accuracy was about 80%. I think it's more now, but it was in 2004 14, I think, or 15. So I think these tools are much more advanced, and with these tools we can use, and it is why it's important to support the data sharing between research institutes and support the research and harmonize the regulation, because supporting these new technologies we can achieve much more, and to train and teach the AI systems we need data, and clear data, not compromised data, and we can use this for early diagnostic tools, and also there's more evidence, but you are much more experienced and knowledge in this topic, that we can use this to help people with, for example, Alzheimer disease, to a little bit slower some parts of the symptoms, and also there are these new well-being apps. I'm not sure that this is the correct name, developed by different institutes to help people with depression or mood disorders to get a real feedback, and not this artificial feedback from social media when they open the different social media channels. And we can use this, but to use this and to help people, we really have to improve the health literacy. Why we are doing this? What is the purpose of the researches? Because I think there is a big lack of trust, especially after the COVID, because people usually don't know who the researchers are, what they are doing, and we all know how important is their work. But to help people understand this, I think we have to put attention on health literacy and explain how science works. To say something, we have to have some data and do experience, prove, disapprove the results, and afterwards we can say something, and not immediately. But and we all witnessed the effects during the COVID, that people waiting for the quick answers, but not the science works not that way, and to regain the trust, we have to explain this, why our answers are a little bit slower, but actually the answers are the accurate ones. So there are many fields we can use these new technologies, but we have to put some attention on regulations and also on the funding of the research programs.
Well, it's probably a collective question that I would have now, but we discussed obviously the issue of brain health, brain disorders, but also how the brain can be looked at positively because of the impact to people, their families, but also to productivity, inclusion in society. And we need to recognize that the brain is more than an organ that can dysfunction sooner or later in our life. It's also the seat of our skills, and it's also the way by which we can interact with colleagues and with society. So from your perspective, and with this new mandate opening up, where would you see policy initiatives that could reflect this dimension? Obviously, if you go back to the speakers that were on stage before you, there was already a gamut of very concrete regulations or legislative files that they would happily reopen. But I'd like you to speak freely on that, and obviously nobody is listening, so you can speak in confidence.
The implementation of European health data space is crucial. How we will implement and how we can use those new possibilities. As I mentioned, the harmonizing the regulation across the member states is very important. involve more people in our research, to share data, to have a cross-border research programs. It is very important because if the regulation is different in one member state and in other, and more complex in the third one, it's very hard, and it has a big administrative burden, and also costs more to run a study or a research. I think we have to support healthcare workers, because in Central Eastern European region we have a real healthcare workforce shortage crisis, and without healthcare workers actually will lose our possibility to help patients, because without healthcare workers, without nurses, we cannot care at that level with patients what we expect or we have to. I talked about the promotion of data sharing, and I really hope that I can support and highlight the importance of public awareness campaigns, and the campaigns focusing on improving the health literacy. We'll see the effects, and I'm really hopeful with the AI Act and other regulatory frameworks and works, but we'll see what possibilities we will have in this mandate. I can promise that I will be very active, and I hope that I am very active now, because as a doctor I think it's a real and big responsibility on my shoulders to care about these topics and to care about our brain health, because the brain, through our brain we see the world, understand the world around us, make conclusions, and without our brain we are only an empty shell. So I think that actually the brain is the most important organ. Okay, I agree that we cannot live without a liver or anything, but the brain actually is determines who we are and how we are thinking about the world, and that is the most important organ to me.
Thank you, Andras, and I don't think you'll find anyone in the room to contradict you today. So, but Tomáš, you had something to add there?
Yes, I would like only share with you my views about regulation. People, really, don't do more regulation. I think that most effective things only to cut the barriers between the countries. Problem, what I see from my perspective, really when I did my PhD studies, we have it here a lot of research capacity, but we are not sharing in member states the information. We are not work together. We have it 27 states what are still a lot of isolated, and we are not as a one team. This is USA, this is China, this is India. And second things, what is for us key issues as a for member of European Parliament, but it's not something linked with brain, it's linked with our smartness. We have it here a lot of predator who are taking the through the artificial intelligence the data, especially from the China. China is collecting all research, all data, and they are doing a lot of analysis of this data. And we have to be much more smarter for the future, and really shows that we can do it without sharing all the information with someone from the third countries, but we need to do it in our own research here in Europe. And then if we conclude it, we can sell it or we can share it. So this is my point of view.
Mm-hmm. Well, thank you for that, Thomas. And obviously, our event, the Brain Innovation Days, is to celebrate research that is happening in Europe and making sure that it continues to be so and remains ambitious in the future program. I'd like to continue this conversation, but by bringing, I said in introducing, I'll take liberty with the program. So let's continue this conversation, but I'd like to bring on stage Peter Carey and Astrid Arnesen. Astrid, I'm really sorry I hadn't seen you had arrived, but please, welcome, and we celebrate the launch of your interest group a few minutes ago. That's basically the reason why we were waiting for you. So we okay. Okay, perfect. And Andres, if you'd like to stay or if you need to go, you let us know. But it's just Oh, okay. Otherwise,
I just want to say thank you.
No, but thank you. Okay, thank you, Thomas, and thank you, Andres. So what's great is that they're leaving the stage, but they are staying. So I wanted to ask you your perspective on what we just heard from Thomas and Andres before we open your panel. So Astrid, maybe you'd like to go first.
Yeah, a difficult question to just respond on the spot. No, it's easy. Yeah, it's easy. Okay. So regulations, yes or no, we need some of those. And there are very many good intentions among the MEPs also here in the Parliament. And the key thing is how can we put that actually into action, and what's been also discussed by previous speakers here is how can we get really most out of the investment and the efforts that we take. And I think that's a joint effort, and me and Peter discussed when we briefed for this session that we really need to collaborate and have stakeholders come together. And I think patient groups, among those I represent here, is really a major factor in making things the best out of the actions that we take, actually.
What came into my mind is that we talked about social media, misuse of social media, good use of digital assets, what we have around. We talked about financial issues. We talked about forgotten parts of brain and mind and this and that parts. We made a lot in the last years. I just wanted to remind you that what Thomas mentioned, that we achieved a lot already, and recalling the past achievements, it's an asset. Use it wisely. We don't have to reinvent the wheel, because we all know that we achieved already a lot. And sometimes we tend to dig down, but someone else already invented. So I just wanted to call your attention to use the assets, for example, the patient organizations, any type of patient organization, chronic mental illness patient organizations, but chronic illness organizations as well, because it's crucial to understand each other and cooperate together. Thanks.
Well, thank you. But immediately in building on that, I wanted to ask you, how do we address, because awareness was mentioned, education was mentioned, how do we address and how do we improve this awareness and understanding of sometimes overlooked, if not overlooked, misunderstood disorders that you basically are representing? So, Astrid, maybe.
There are a lot of steps we can take. I think really, I mean, meetings like this and the one I come from by our own interest group there is to talk about this. I think the reality that neurological conditions as well as mental health issues are really related to so strong stigmas. So even if we are, I think all in this room have closed ones that are, affected by a neurological or a mental disease themselves, we tend not to talk about it. And we need to be outspoken about it. We need, the leaders in our society to tell, you know what, my mother has Alzheimer's disease, I suffer from migraine or whatever it is that we suffer from, to break down the stigma, because really we look up to people and we tend to, okay, if she can have that, or if he can, be open about that, maybe then it's not so dangerous and we can all be more transparent. I think that's really a major thing that can break down the stigma and then also call for the action followed by that. Because I think that's one of the reasons that neurology has been so overlooked and not prioritized, because, we are basically all affected by it. Why isn't it prioritized?
Mm-hmm.
It doesn't make sense.
So, Peter, how would you relate to that notion of making the invisible visible?
When we talk about mental health issues and we try to address, we have a great discussion about why are you schizophrenic, please. So I don't think that question will give a good vibe for the party. When I try to speak about the illness I represent myself, all the parties around in that very moment stops, because it's talking about schizophrenia and about the issues, what is behind. For example, talking about the psychosocial aspects of schizophrenia in the past or in the future and in the very present is a party, and I wanted to use another word. Imagine the discussion in the future when you are brave to answer that I survived that and that in my past, it was horrible, or I was horrible, I made a mistake, or they made a mistake, I was traumatized, and it is a discussion. And today I believe it's bipolar, schizophrenia, I don't know, this or that, mental health disorder. Who wants to hear it today? Nobody wants to hear it today. Nobody wants to understand that, are you traumatized? Okay, but don't tell who was. Okay, until that moment that we are not brave enough to understand that we have a divorce. Okay, we feel bad. We can find that pill, but it's okay. But certainly I want to talk about the divorce with the best friend. We can do that. But if you have bipolar, nobody will understand what was the cause of the trauma, what was the real trauma in the past, until that point that it will be normal to talk about the bad things in our lives as well. And here comes what was already mentioned, that social media is too positive today. Everybody wants to be too fantastic, outstanding, brave, nice, until that point that everybody will understand that we are so fragile in this stressful society, and if something is bad, we can bravely talk about that. That point will have mental health patients to speak openly about what happened, and those who caused, for example, traumatic situations will say that, okay, I made it, really, I was not a criminal, but I made a trauma, so what? So we can go on. I think it could help.
Thank you. Astrid, we have been discussing about patient involvement and meaningful patient involvement in research, in policy making. We obviously all recognize the value of it. How would you describe it, in your view?
Well,
I know, I'm asking only tricky questions today.
So I mean, patient experience is really a unique expertise, I would say. Lived experience is a unique expertise that cannot be replaced by studies. So we represent different expertise here, the different stakeholders. And the patients bring to the table this expertise, and I think really also to recognize that we have the highest motivation of all of us, I think, I dare say, because it's about our lives and our, it's life and death for many of us. And I think we need to put in place infrastructures, because over the past 10 years we are being requested to take part around a lot of tables and around a lot of processes, but we are not resourced and supported to enable us to have an infrastructure in place internally. Because what we want to see is not random, sorry for that expression, random people who are able, which can be great, but we need them to be representing a community to make sure that we have some kind of, backland for what we are bringing to that. So to have that infrastructure, to have that support for patient organizations, to enable us to line up people in all different kinds of aspects, I think that will benefit definitely. I mean, research, I have learned a lot now in my disease field, which is Huntington's disease, where we are collaborating a lot with researchers and pharma companies doing research. And there are huge potential for improvement. In efficacy, in having return on investment, and we see it, and we tend to think that sometimes academics and also pharma industry is a little bit too conservative in terms of really trying new innovative ways to do things. And we don't have time. We want this to happen more fast and efficiently than it does today.
Okay, thank you. Peter?
What we saw in the last couple of years, that meaningful patient involvement is real, and it is there, already there. A couple of stakeholders already know. We live in the era when medical pharmaceutical research is rooted on the patient's needs. It isn't a substance that was tried out for hair growth, and after it became a heart medication, but finally it was first a demand of patients, was created by a pharmaceutical company, and finally it is a medication. I think it is beautiful. In the past we can criticize many researches because the final outcome was given to those patients, was eaten. Today we say I would not give it to my grandpa, but it is evolving. What we need, meaningful patient engagement. I can tell that, for example, international steering committees, steering boards of researches, professional writings, magazines, or all stakeholders in the mental health field can understand that the real involvement of patient is crucial from the beginning to the end of a project or of a professional writing, for example. Just an example. Many of you, and I'm very happy I did not say, my name is Peter Carey, and I'm glad to be here, President Gambian Europe, board member of EBC. Meaningful patient involvement. I'm board member of EBC. I think EBC made something very big, involving a patient organization in a meaningful way to shape the future of brain and the social brain, what I represent mental health, the social brain. And it is outstanding. Or if we check, for example, if there's a news article in World Psychiatry, for example, in the good old days, we received the article, you remember maybe, and I was asked to check the box. Is it okay? And I said, yes, it is okay. And what is today? I am asked as first and second, or I don't know who, author, co-creating that article. And you know what? The impact factor of that article is much higher than the other one. Simon is here, somewhere here. Yes. Please say yes. So we have evidence that if patients are deeply involved, then we can answer deeply the patient's needs, and then we can have a better future. Thanks.
Thank you. So, Astrid, what would we need in order to align our understanding of what it means to live with a brain condition, or to understand better the impact of a brain disorder? Because obviously we had the perspective from many different tiers of our community, but there seems to still be this lack of recognition. How can we create at best an environment like this? I mean, do you follow what Peter just mentioned, or would you have any further suggestions?
Yes, absolutely. Up till now, for patient organizations or patient groups to be funded to do research has not been possible through EU funding. We are always invited to be part or to collaborate, but we are not able to be funded to do the job. All the other stakeholders are. So there are many things that can bring us up as partners, as equal partners, and not as something nice to have, or we invite you with you because we feel sorry for you. We are partners, and we bring our expertise and our part of it, and other stakeholders bring their. And that's really something I hope I will see. And I think the European Partnership on Brain Health and the research planning that is ongoing now is a first very, very important step in this direction, where we bring the stakeholders together, collaborate, and think long-term, plans and what to prioritize, and then enable us all to take part in that on equal terms.
Yeah, and I think we had in the discussion earlier about the joint clinical assessment an example of very ambitious commitment to make it happen, but very concrete barriers in disabling basically the implementation of such a system, with the notion of conflict of interest to stakeholders' engagement. How do you see that these barriers are actually serious, but where do you see we need to work harder in lifting those?
Yeah, I think first of all I want to say there are a huge difference between having an interest. We have, I can tell you, we have an interest in drugs and therapies coming to patients, and to have a conflict of interest. And I think that's something mistaken, and that we are kind of not seen as serious because we have such a strong interest. Now, that's one thing. The other one is joint, evaluation, health technology assessment, and these things can speed things up and save, waste and double work and all these things. And patients should have a voice at that table. I mean, come on. It's about us, it's about our health, and we know best all this invisible, I think we have it here, all the invisible parts of dealing with neurological conditions and mental health issues can only really be in-depth understood, and we need to communicate much more on these issues around these tables where decisions and evaluations are made.
Thank you, Astrid. So, Peter, how would you relate to these notions of barriers to collaborations? Where do you see them? And how would you see an option to overcome those?
The option I would choose, if I may. I'm a positive guy. I was really surprised when I first had a discussion with European Rare Disease Organization. We were talking about possible collaborations. Everybody said that it is not my field and I should not do that. But we figured out that they invented already what we wanted to do. And they had 5 years ago what we wanted to achieve. Okay, after we had a discussion with the cardiovascular patient organization in Europe, and it turned out that, oh my God, those families, those parents, those patients struggle with something similar that mental health patients. Certainly we dare not to say because we have that stigma factor, certainly. But hearing from these other organizations that, oh, hello, it is already there. It shows that effectively, even cost-effectively, even saving time, even answering your question that we want this answer no today, we can have these answers sooner than we think, because if we have a real broader cooperation with real other organizations in Europe and beyond, because in Africa they have brilliant research projects. In the United States they have very good outcomes in some aspects. We just sometimes do not see, because when I am, for example, at a conference, I chose a couple of slides, I sit there and I'm full with that presentation, but I do not have long-term cooperation with local organizations. That's what Gamian and the EBC, for example, tries to do. And I think it is crucial because we can solve today those problems what are solved in another organization in the field of mental and brain health as well sometimes.
Yeah, thank you. I'm eager to also leave you the floor if you have any questions for either Astrid or for Peter. I see no reaction. Yes, Paola. Sorry, please. I've almost introduced you. Please introduce yourself so that everybody...
I'm Paola Zaradian, Director of Scientific Research at the Italian MS Society, and also chairing a global initiative on patient-reported outcome for multiple sclerosis. And I have also I was lucky to coordinate a project on engaging people in research, people living with the disease in research. And I don't think that this is a standalone strategy, because we also need to review the way how we are managing research and the research governance, and go more towards a participatory governance concept. I'm saying this because when Astrid said, how we can measure this, the efficacy of this engagement, I think that this, as soon as we are going to show that this is going to be a return of investment also for the other stakeholders, this is going to happen. So my question is, don't you think that really we need also to invest more in the science of patient engagement? Because this is not only, it's not going to happen by chance. We need people expert in the field, able to get this happen, and consider this a science, not just a wish to have. So I'm wondering whether we can do more in this direction and trying to turn responsible research innovation into action.
Thank you, Paola.
Thank you.
I guess that the question was directed to each of the panelists. So, who'd like to go first?
Yeah, well, so sure, and I think we have a little bit of research on patient involvement in conducting clinical trials, for instance, and it demonstrates that they are more efficient. There is higher retention. People tend to stay on because they are more patient-friendly, put in place. So definitely, we should document the value. For me, it's self-evident, but we need to. We live in a scientific-driven world, so that should definitely happen. Fully support that.
Thank you. Peter?
Since my presidency at Gamma Europe, it is my focus point, so I love your question, because patient inclusion is somewhere there and not really well documented. If you want to find the peer support evidence, if it is okay or not, it is 2 years old, I think, the first one, where we analyzed peer support inclusion in mental health field. There was a research from Hungary, for example, that informed patient will have a better outcome, and peer support inclusion and informed patient will have a better outcome even with the same medication in schizophrenia. But today, if you look around, and thank you for EBC and Gamian's work, we deal with patient inclusion. And we have very, very good and novel methods of measuring and dealing with the outcomes of the good patient involvement. And we see what is not good, not really valuable patient involvement. And right now we have a so-called peer support project in Europe, where we try to shape and try to figure out what is the best practice in patient involvement in any area of mental health and maybe later brain health field as well. And I think that would be outstanding, because it is different country by country, illness by illness, condition by condition, and impact by impact, because family is involved as well. So I think it is very crucial, and we need it. I absolutely would support.
Mm-hmm. Thank you, Peter. Actually, the panel is called The Need for Action in Managing Brain Disorders. So I'd like to ask for your conclusion in maybe 30, 60 seconds on what would be your call to action in the context of the conversation we just had, or maybe issues that we have not addressed and that remain to be explored or to be discussed.
Okay, so I just spoke with a colleague of mine, and he said we should be very bold. For many, many years, we have had a plan called Europe Beat Cancer. And it has helped thousands and millions of patients, and it has prioritized research, it has focused research and treatments coming to patients. Can we please do that in urology and brain health? Because we need it. And there is so much, brain capital is real. We should invest in this organ because it pays off in all aspects in society and in individuals' lives. So maybe that's my small ask.
Well, it's a great one, but that's giving a challenge to Suzanne, who needs to summarize the discussions, and you have been summarizing exactly what other contributors have been saying, and I would add to that maybe patience in investments. So, and we probably get there. Peter, over to you.
It is very tricky, but I just created a LinkedIn post where I asked that, is it a good, poster sign that mental health can be everybody's business? And I said that I don't like this word, because mental health is everybody's responsibility, and everyone can be mentally, problematic here and there. Why not? But I did not like mental health, everybody's business. It is my message for today.
So can I just expand by saying making brain health everybody's business?
Making brain health everybody's business. Let's talk about it.
Okay, let's talk about it indeed. And be bold and be brave. Okay, so that's probably leading us to the conclusion of this event. Please join me in thanking Astrid and Peter before we invite Tomáš. Thank you. So, Suzanne, over to you.
Wow, what a meeting. I've got some scribbled notes here, and I'll see if I can do my best. We're all on the same page in this room, and we understand the complexity of the brain and the need for change. We've heard about the burden, and we have some really important messages to give. We should be bold, and we want to be heard. We, the brain community, want to be heard. Our messages need to be evidenced. They need to be compelling, and they need to reach the right audiences. And that's what we work with tirelessly at the European Brain Council. We've heard personal stories. I think there's at least how many people in this room? 60 people? Each of those 60 people, we all know someone, a relative, a colleague, many people perhaps in our lives that are struck with brain disorders and the implications of that for their daily living and for those around them. We all know the problem. We've heard about the burden today. We kicked off by hearing about the burden again, and we're very aware of those statistics. 1 in 3 people are suffering from a brain disorder, and this means a loss of brain capital. And when you have all the discussions we've heard today, we think, well, why isn't brain health at the absolute top of political agendas? It costs Europe, we heard earlier, is it 3 billion per year? This is enormous. Think what we could do with that in research to do something about the problem. We've heard that we're good at preventing death, but of course that means people live longer, but we need to impact on brain health for those who live longer. And we need to start at an early age. We need to think of children and youth and protect their brains and build up a future generation who can really contribute to society and contribute to brain capital. I reinforce the need for an intergroup. I just plug it again. The intergroup will, of course, bring stakeholders together to impact on EU policy agendas. This must surely be very, very important. We really hope that goes ahead. The name of the intergroup is Brain Health and Brain Research, and this is music in my ears because we talk a lot about brain health because that's what we can, first of all, explain to people, the burden, the problem. But brain research is part of the solution. We heard there's a lot we know about the brain, but even more that we don't know. And for this, we need much more basic research. Again, music in my ears. And I was reflecting over some statements that were made by US presidents. So, you know, in about 1961, I think it was, JF Kennedy had the ambition to put a man on the moon, and he achieved that in 10 years. And then President Nixon, 10 years later, jumped on this great bandwagon and decided that he was going to cure cancer. He had a war on cancer, and he put a massive investment into this. And, of course, we know that for physics principles, we were ready to put a man on the moon. But in those days, we weren't ready to cure cancer. But what I would say is, as President of the European Brain Council, I've learned so much in this role that innovations are exciting. They're happening all the time. We need more of them. We need more brains on the problem. We need more young folks coming into research with great ideas. And we need investment across the board, in academics, industry. We need investors. We need, a full spectrum of people supporting basic research. What we learned, though, also from these two presidents is that it takes time. There's no quick solutions. You know, Parkinson's research, for example, started with the discovery of dopamine in the 1950s, 60s. And it took a long time before someone got the Nobel Prize for this discovery, and it really impacted on the lives of many. So it's a long-term investment. It needs commitment, it needs co-creation, it needs networking by wide members of our community. It needs to take into account the patient perspective. We heard it needs leadership and engagement of politicians and policymakers. It needs money, 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 and more money. We heard it's chronically underinvested. We need to get the narrative right when we're asking for money, you know, we need to get the right message to the right people for this ask. And we need to put money into where it's most needed. And I'd like to say again that when it comes to the brain is so incredibly complex that, in fact, we need more investment for brain research than we do for most areas of medical research. There are so many brain disorders, and we have got yet so much to discover about the brain to impact here. We've heard about support being needed for AI technologies and its possibilities for diagnostics and all kinds of new opportunities. I mean, it's mind-boggling. We're only beginning to understand the possible impact this will have on research and brain health. We heard that we need to improve health literacy, how science works. We must be good at this, folks. We got to get there and get the right message to the public and to people who need to understand how the brain works. We need to break stigma. We need to talk, and we need to call for action. We need to make brain health really top of all of our agendas. So it's been a great kick-off for BIDS. Thank you so much to all the speakers and to all the discussants, to the audience for your participation. And I really thank you for welcoming us here. We can't do it without your support, and we look forward to interacting with you much more in the future. Thank you very much.
Pleasure. I totally understand your points, Susan. Also, money, intergroup, and really be very active here in the European Parliament. Also, no, I'm joking, but I would like to conclude with something positive. Really, if you trust to victory, then victory will trust to you. I know very well that from the word brain research is something what is really more complex and more attractive topic than it was before 10 years. Also, let's use this attractivity and push it to the European level. And if I see here more than 60 people what are actively looking and participate on this event, and they are not sleeping as in other events, I'm very happy that we are here and we can continue with this work. And I promise you, but you know me, that I will do my best, because it's not only about the promise, but it's in my case about the action, and I'm doing a lot of things, and I hope so that next time we will be here as a new intergroup of European Parliament, and we will have it here opportunity to speak much more complex about the issue of brain and about everything what you mentioned before. It's pity that I cannot be here all the times, but I promise you that next time I will stay here and we will be in touch. Also, enjoy this evening, and all positivity and all goals what you take from this event, take to your life. Thank you very much.
And all thanks to the team behind the organization of this event, Stephanie, Hugo, Michaelis, but also Regina and Danai, for securing the presence of your boss in this meeting. We know how complicated that was. We now have a drink downstairs in the MEP restaurant, and those just coming in, don't think that we didn't notice you arriving just at the point of time for the reception. So that's going to be on the ground floor in the MEP restaurant, if I'm correct. So just make sure that you maintain the herd packed together so that we don't lose anyone in those long and void corridors. So see you around the drink later on, and thank you for your participation.